Hello again, chaps and chapettes. How are we all doing? It is lovely to see you all again, as always. Okay, guys, let me ask you this. Have you guys ever seen a set of films called The Human Centipede? It's basically about a crazed German doctor who drugs and kidnaps three people, and he surgically attaches them from backside to mouth, and they're expected to go on living through the secretion of the person that they're attached to. I won't go into too much detail. It is quite graphic, it is quite disgusting, and if you're eating your teas or having a cup of tea, I don't want to put you off your stuff. But I've basically got a sort of example of something similar. This happened here in this country. A doctor who used to work at Great Ormond Street Hospital has been doing surgeries, unnecessary surgeries, by the way, on children and leaving them with disfigurements and lifelong injuries. He is now working in Dubai. Well, he's had it away on his toes and he's ran to Dubai and he's now working over there as, I suspect, a surgeon, a Dr. Frankenstein in the making, if you might say. So let's have a look what this twisted shithouse has been up to, shall we? It reads here, GB News' website. Great Ormond Street Hospital is conducting a review of over 700 patients after a rogue surgeon allegedly left children with life-changing injuries following a series of unnecessary operations. Of 39 cases reviewed so far, 22 children were found to have been harmed, with 13 receiving potentially lifelong injuries. Yassar Jabber, I'm not taking the piss, that's actually his name. Yassar Jabber, a reported expert in limb reconstruction surgery, had his UK medical licence revoked in January after concerns were raised, and he's now working in Dubai. Well, if he's now working in Dubai, and I assume you know where he's working in Dubai, why not get him by the scruff of the neck, throw him on an aeroplane, bring him back here so he can face justice? Hang on a minute, what am I talking about? Justice here in this country. What would happen to this man if he was extradited back here? He'd probably get what? Get a council house and get put on a handsome pension from now until the day he dies, and we'll probably have to cover the cost of his funeral when he eventually does pop his clogs. I say, let the Dubai authorities handle this. We all know how they dish out punishment over in the Middle East. I think that would be a perfect fitting end, wouldn't you? This guy has disfigured children, has left them with lifelong injuries. Children as young as 4 months old. This guy is a waste of space and doesn't deserve to breathe oxygen, if you ask me. He's alleged to have carried out an unknown number of unnecessary and harmful surgeries on children as young as 4 months old. The unnecessary surgeries have left some children with different leg lengths, some by as much as 20 centimetres. Further injuries include nerve injuries and muscle damage. One child had to have a leg amputated after a procedure carried out by Jabber, and the other is facing the threat of amputation. The review, first reported by the Sunday Times, said it had seen a confidential report by the Royal College of Surgeons, which was critical of the wider culture of Great Ormond Street Hospital, accusing the hospital of being operated like a political organisation. What I think they're getting at there is the whole trans movement, with children going in there and getting things cut off and getting things stuck on, that kind of thing, the cultish, twisted weirdos that do that sort of stuff. So, let me ask you this, guys, my usual question after I go off on a rant. When we are bringing in carers, nurses and doctors from the third world, places like Africa, Namibia, Uganda, Middle East, places like that, doctors and nurses, all that kind of thing, we're bringing in people to look after children, people who can't look after themselves, people who rely on other people to get up in the morning, wash themselves, feed themselves, people who are mentally disabled, people who are crippled, paralysed, you name it. We are bringing in people from the third world who can hardly speak a word of the Queen's, hardly speak any English, yet they are being trusted with life-giving care to people who require it. Over in the third world and in the Middle East, they have a different healthcare system as we do here. We are quite stringent when it comes to healthcare. A lot of guidelines have to be followed, Hippocratic oaths, things like that. We have nice, clean, disinfected utensils. We have, on the whole, nice, clean hospitals, nice, clean hospital beds, surgical rooms, theatres, they call it. Over in Africa and over in the Middle East, they don't have the same standards. So when these medical students are coming over and learning their trade over in there, India and Pakistan and Africa and stuff, they're bringing in a different type of healthcare to people who should receive a higher dose of healthcare. What I'm basically saying is, guys, The carers, the nurses, and the doctors that we're bringing over here, poaching from other countries, which I think is diabolical in itself. We should leave medical students and doctors in the country where they studied for them to have. We shouldn't be pinching other people's doctors and nurses, but they should be scrutinised at least every 4 to 6 months, how they are handling care, how they are dishing out medication and surgeries and such. I mean, look at this example for a prime example. We've got a bunch of children left with disfigurements and lifelong injuries through some batshit surgeon who came from Dubai or God knows what other sandpit shithole he came from, and he's destroyed some children's lives. Need to be scrutinised a lot more. Need to be under a microscope. These carers who can't speak a word of English, who are abusing dementia patients and stuff like that. You've seen the videos. You've seen the stories plenty of times. I've done a couple of videos myself about it. Every 4 to 6 months, a thorough review of how this person is performing within healthcare. It'll stop stories like this. It'll stop people getting disfigured. It'll stop people getting abused. And it'll stop people getting murdered. Wouldn't you say? Anyway, guys, that's my video. Please do let me know what you think of this Dr. Frankenstein in the making. Should we extradite here, or should we let the Dubai authorities deal with him? I'm all for the latter, personally. Do let me know what you think in the comments. Thanks a lot for watching, guys, and I'll see you in a bit. Cheers.